One of the most frustrating things in healthcare today is quite often it feels like the left hand and the right hand don't know what's going on. You have multiple physicians that are involved in multiple parts of you, and I don't say that jokingly, it's true. You might be seeing your lung doctor for one thing, your heart doctor for another thing, and who's the one looking at you as a holistic human being? That's really where hospice started. And so palliative care basically stands in the gap and helps navigate that. And so the impact is absolutely huge because people feel like stuff is being done to them in healthcare, whereas now for the first time they feel like someone is truly collaborating with them, listening to them, deeply listening to them, and truly finding out what matters most to you, and then trying to walk alongside them to make sure that actually occurs, along with the rest of healthcare. It's a very collaborative approach.
Standard medicine is like getting on a conveyor belt, and everybody's pushing you in a certain direction. And one of the things that we do in palliative care is we listen to people, is sort of give them back a little bit of more control over their life. And they feel listened to and heard and validated. And so that provides people with the dignity and the hope in the midst of serious illness and stress that they really need.
So palliative care is a medical specialty aimed at providing a holistic program of care to people with a serious life-limiting illness, COPD or like congestive heart failure, maybe Parkinson's disease. Many of our patients suffer from forms of dementia, and so that becomes very challenging to deal with, not only for them, but also for their families. And so palliative care is an interdisciplinary approach to being able to provide that care, to relieve symptoms and to relieve suffering. We aim to provide that care, to stand in the gap, to help them find the resources that they need to take the best care of their family member that they can, and to provide a quality of care that you can't necessarily get seeing your primary care doctor.
Where I struggled as a doctor in the previous system is that I could see patients in the office and give them medicines, but I did not have the expertise or the support to really provide that care in their home, or to provide help or support for their caregiver who were really stressed by the needs, or to help them make decisions about other specialty questions that they may have.
Palliative care for an organization is a loss-making program. At Four Seasons, we've always felt that it was the right thing to do. I remember one gentleman very clearly who was very close to my own age and had a couple of children who were close to my daughter's age, and he told me that he valued coming to see us, valued the people in his palliative care team because we were the only people he had ever encountered in the medical community who listened to him and saw him as a person.
A lot of the obstacles are regulatory. It feels like the government is trying to make our job harder, not easier. And then on top of that, they've given us less and less resources. And so they're requiring everybody in healthcare to do more with less. That you have to provide a better experience, increase your quality of care, but you have to do that on less resources.
Unfortunately, our healthcare system is really pushing for shorter and shorter visits and more procedures in the way it's reimbursed. And so to stand against that and to say, no, I want to give each patient and each family the quality time to understand what it is they value and what it is they want from the healthcare system, to really listen to people and to help them. It is very countercultural.
Our insurance system just isn't set up to pay for things that are valued in that way. Gone are the days when your primary care doctor came to your home to see you when you got sick. And so if you can't get to the doctor's office, that is very challenging. And the average primary care visit now lasts 7 minutes. How you have conversations about what your goals of medical treatment are, or how you want to spend the rest of your life, the end of your life, in 7 minutes, I just don't know.
Currently, we have the ability within our community to have nurses, social workers, chaplains, nurse practitioners, and physicians surround patients and their families with the holistic care that they really need to keep them in their home with a good quality of life. In their home with a good quality of life means help with medical issues, it means help with the stresses that come along with those medical issues, and it may mean help with spiritual issues and finding resources. And so our team is able to do that.
I've always believed that this is a test network, that we've been given this responsibility to not only care for our community, but what we do truly does echo throughout the country. Research, one of probably only about 3 hospices in the country doing research. What we're figuring out alongside with patients is bringing treatments to them today. It's also increasing the body of knowledge that can help affect to the positive patients many, many years into the future.
So palliative care is going to solve the nation's healthcare problems. And I'm really excited about this because currently we're in an environment where when someone gets sick, they go to the doctor gets paid, everything is a fee for service. But what palliative care does is create value. And what palliative care helps people get better quality of life in their home. And if you can keep someone out of the hospital and not needing a $20,000 hospital bill, then what you've done is you've helped that patient live a better life with higher quality in their home, and you've saved the healthcare system a $20,000 hospital stay.
We're also involved in the whole, how do you measure quality of care and palliative care? We're actually involved in creating a reimbursement mechanism for palliative care. If there is no reimbursement mechanism, it's incredible to see how far palliative care has come without a reimbursement mechanism. But if there is a reimbursement mechanism, it's going to be the norm to get palliative care. This continuum of care that we've created at Four Seasons is still very unique. And so our community benefits, but we're also kind of the Bell Laboratories for the country as a whole. We need to be able to try new things, because if we don't develop a new pathway in healthcare, it's not going to be good. And the system, the way it functions today, in some respects is very broke, and it's going to go broke financially. And so we feel here that we're also not only being innovative locally and collaborative with the folks locally, but in us figuring that out, it's going to have benefit for the country as a whole.
The message is that any one of us could find ourselves in a position where we are suffering from a chronic condition or from an illness that may take our lives. This isn't a lottery. We don't get to pick how we spend that time or what necessarily happens to us. And so being able to have palliative care as a resource is not luck. It's there by design. We're fortunate in this community that we've had people with vision, with foresight, who have intentionally put together a service that can provide care for any one of us in that time of need. And so by having our community support our program, we're able to support them in a different way.